there is a technique that I utilize in my office. It's muscle testing. I mean, the kind of the broad way of explaining is muscle testing or applied kinesiology. And it's a way of accessing actually the autonomic nervous system and see how it responds by introducing certain stress factors. And that stress factor can be a chemical, a metal, or it can be a stress factor of just applying pressure on an organ that is weak. So it's a fantastic way of getting a direct biofeedback to see what goes on in the body and how it responds to whatever it is that I want to check. By doing that, you can then check for and seeing which organs that are out of balance, and you can also see what kind of chemicals, heavy metals, pathogens, food sensitivities, or other emotional trauma, which we're going to get to it a little bit later on. Also other interferences like certain scars, external scars have a huge impact on a person's health. So you can then assess all these different things by a very, very simple technique. It's completely pain-free, which you can't say about all techniques that relates to health. And you're not going to lose a limb or an organ while we do it. And as I said, there's going to be no needle that's stuck into you while you're doing it. So you can find out a huge amount of information about what's going on in the body by assessing then the function and the reaction of the autonomic nervous system. And the way it works is that if I apply pressure on an organ, if that organ, from each organ you have nerves that go out to the skin surface. And when I apply pressure on those nerve endings, I create a stress signal onto that organ. If that organ is healthy, it can handle that stress. If it's not healthy, it overwhelms that organ. And there's a signal that's then sent then to the brain, and actually through the hypothalamus that I talked about a little bit before, and through the limbic system, then to the autonomic nervous system, that then controls then the muscle spindles. And you can, if you use an arm, you can use a leg, you can use any kind of muscle actually. I like to use the arm when I do the muscle testing, this muscle right here. And it will cause, if there's a stress, it will cause a downregulation of this muscle. So it's hard to keep it strong. So a way to say it is that if I create stress on an organ that's already under stress, all the energy of the body will go towards that organ and try to protect that organ from that additional stress. And it does not care then about keeping this arm strong. It becomes very secondary. The whole focus is focusing on whatever organ it is that I'm applying stress on that is weak. So it's like a stress challenge test on the organs. And it's become a very accurate way of assessing it. And for instance, if a person has a thyroid issue, and a lot of people are dealing with hypothyroidism, it takes a long while before it shows up in the blood. The body will do everything that it possibly can to make sure that the blood levels are as normal as it can be. When it starts to show up in the blood, that means that the body has gone to the point where it cannot compensate anymore. It's gone so far that now it's just given up and it starts to show up in the blood. So a person can be extremely fatigued and have all different kinds of thyroid, hypothyroid symptoms, and they go to the doctor and they say, your thyroid levels are fine. T3, T4, TSH, all of that looks beautiful. You're a picture of health. And meanwhile, you're dying and you can't get out of bed. You're depressed, you're exhausted, hair is falling out. All these type of symptoms that are connected to hypothyroidism. So with this, you can then assess an organ, assess an area of the body way before it gets to that point where it shows up in the blood. So you can actually just see whether that body is is weak enough so that it cannot handle that additional stress that I'm applying when I'm just putting pressure on those nerve endings. So do you mind just telling a little bit about, kind of very briefly, about some of the issues that you've dealt with?
Sure. My name's Joe, and I've known Dr. Karlfeldt for what, 2.5 years?
Something like that, yeah.
And I've counseled with him briefly about some issues I've had. Not severe, but my blood sugar levels were tended to be a little high. And I hate to call it diabetes because it kind of locks it into a disease that you can never be cured of. I call it high blood sugar. I've been working on some of the things that Dr. Karlfeldt told me about, and I've seen some improvement, but I'm still not to the level of, I guess, vibrant health, really, really good health. I still have some issues along with that. Other than that, I think I'm tending to be relatively healthy, other than my blood sugars that are not quite at the level they should be. And there are some things I'm trying to work on, and I believe that I'm maybe toxic in some ways, my liver perhaps.
Well, we'll see.
Well,
so
I don't know. So
the reason I'm curious is because I've never muscle tested him. And we just spoke. We met like in a health food store and at a lecture
3 years ago.
Yeah, exactly. So, and I've never assessed and see what's going on. So I'm very curious to see what's going on. So please, if you want to put your head right here, and the feet just facing outwards. Okay. Yeah, that'd be great. Most people survive. I have about a 50-50 ratio, which is getting better all the time. So when I test, actually, can you scoot down a little bit?
You want me to roll up my sleeves, or?
No, you're fine. Yeah. Just zip up your pants, or sit down your pants. So when I do my assessment, I then utilize certain kits, and in these kits then I have certain vials and with different chemicals, heavy metals, different bugs, different foods, and by putting that inside a person's space or inside their field, outside each, or I should say like this, each cell emits light. It emits biophotons. And it's mostly from actually the DNA structure. It contracts and stretches out. And that it sends biophotons. And that's how each cell communicates with each other. But that as the biophoton leaves the cell and communicates with the cells around it, it doesn't just stop there. It continues out. So each living being has a very structured field of light that has been emitted. And in that field, that's where all the information about what's going on inside the body exists. So me then putting something inside that field will then create information that goes back into the body, and the body will respond to it. Light goes both, with information and light goes both ways. It's just like when you're scanning things at the grocery store, light goes out to the little label, the little code, and then it goes back in. That information goes back in. So the information travels in both directions with light. So when I'm putting something in here, when light is coming out, information about what's outside is then going in. So this way you can then see how the body's responding then to any kind of additional substance that you're adding, and how then the autonomic nervous system, how it's affected by it. So first, we're going to do a little bit of an assessment. And I have certain toys that I use with, and I'm not going to explain them all. I will explain this one though. It's a polarized filter, and what it is, it's just a filter with the lines in it. And by placing it in his field, when the light are emitted from the cells, the sum total of all the light, of all the biophotons, come out in sheets. And most of it comes in along this axis of the body. So they should move in this direction outside. They wobble a little bit back and forth, but the majority of it is along this line right here. So if I then have a polarized filter with a grid that is along the line of where the light is coming out, it's kind of like a pleasure effect of the body. And the body goes into what's called a parasympathetic mode, which is a very relaxed mode. And a strong arm at that point should be weak, because it should be relaxed. So all the time, it's not always that a strong arm when you do muscle testing is a good thing. A lot of times it can be a bad thing. So let's see how strong you are. Let me borrow your arm. And just stretch this one straight up. Yeah, just like that. And then put this hand down to the side right there. Then have a good strong muscle, kind of lock that muscle. We're not going to be arm wrestling, just kind of keep it on one location right there. And turn it this way, lock the elbow. Perfect. Have a flat hand. And just match my pressure. Good lock right there. Just match my pressure. Try to avoid me from pushing it down. Just like that. Just have that lock right there. Perfect. This is a way then of checking to make sure.
Dr. K, would you explain that piece that you're doing right there, but in detail?
This is just a check to see if they're right in their head. I'm sorry, Joe. I like you, you know. What it is, it's a very specific acupressure point right here, and the arm should be locked. You have two polarities. There's one polarity on one side of the finger, and then the other polarity on the other side. It should be strong on one side and weak on the other. It doesn't matter. Some people it's strong when I have it this way, and some people are strong when I have it that way. But it should be strong one side, weak on the other. So, and that's with everybody. So you have strong arm here, have this strong, then I just turn the finger over and see. You feel that? It's strange, isn't it? See how strong it is here? I can lean into it. And here.
What in the world?
So this is a way, as I'm saying, it's a down regulation that takes place into that muscle spindle right there. So, and that's, we're just assessing the autonomic nervous system. That's all we're doing. So, strong. Now I'm going to put this